Welcome. On behalf of the Collaborative on Global Children's Issues and the Thrive Center for Children, Families, and Communities at Georgetown University, and the Global Reference Group on Children Affected by Crisis. There's interpretation today in English, French, Spanish, and Portuguese. You can click the globe icon at the bottom of your screen and choose the language you prefer to listen in. You can also submit questions in the Q&A box, and we'll reflect on them at the end of the session. Thank you to all who joined for this conversation from around the world, researchers, policy people, practitioners, and faith leaders. We need to acknowledge that some critical voices are missing today. Some of the leading researchers and practitioners involved in this work have been from the US Department of Health and Human Services, the Centers for Disease Control and Prevention, and the US Agency for International Development. And due to the administration's stop work order, these dedicated civil servants are not allowed to participate in this meeting or speak publicly. They have been effectively silenced, but they are with us in spirit. Their work and this work is of extraordinary importance. New research shows that a significant increase in orphanhood in the last, that there has been a significant, new research shows that there has been a significant increase in orphanhood in the last 2 decades in the United States. The research published in Nature Medicine estimates that in 2021, 2.9 million children in the United States, or 4.2% of all US children, had experienced the death of at least one parent or grandparent caregiver responsible for the most basic needs of the child. This means that on average, one child in every American classroom has experienced the death of a parent or a caregiver. And the leading cause of orphanhood in the United States is deaths of despair, drug overdose, suicide, homicide, and unintentional injuries. This is a public health crisis, and we can learn from other parts of the world about how to effectively respond. As we begin this conversation and learn about the research, let's also keep in mind, every time a child loses a parent or a primary caregiver, we need to ask, are they safe? Are they supported? Are they in school? Do they have enough food? This research and these questions can and should guide our policy and programmatic and funding responses in the United States and globally. I'm going to turn over to an incredible researcher and children's advocate, Susan Hillis, who serves as the Oxford University and Imperial College London as a senior research officer and a co-chair of the Global Reference Group for Children Affected by Crisis. Over to you, Susan.
Thank you so much, Gillian, for the kind introduction. Can I have the slides, please? And our most sincere thanks to everyone joining us on this webinar today. And I challenge you to decide while you're listening that there is at least one thing that you can do as real action to respond. I'll be giving a brief overview on crisis-driven orphanhood estimates and policy responses to protect children. Next slide, please. We know crises are coming fast, and polycrises threaten regions globally with disproportionate effect on Africa, but every region affected. And we think of it as the 3 C's: contagion, climate, and conflict. But contagion is not just infectious disease epidemics and pandemics, as you will see shortly. Contagion can be epidemics of drug overdose and other reasons for despair and inappropriate and lethal expressions of anger, such as violence. Go ahead and go to the next slide, please. Our conceptual thinking about this has really been helpful to us as a global reference group as we think about how to respond. But the truth is, these 3 C's I mentioned typically disproportionately affect compromised caregivers and families who already have extreme poverty or inadequate access to health services, substance use, and mental health difficulties. But the pathway through which families are affected seem to be similar, causing increased risks of caregiver death and illness, increased poverty and insecurity, increased migration and displacement, and increased disruption in basic services. And those pathways also have similar adverse outcomes. Violence and sexual violence increase, early pregnancy and marriage, HIV and sexual and reproductive health problems, mental health distress, loss of family care to orphanages or the street, education loss, and in short, long-term consequences throughout the trajectory of their lives. We actually know a lot about how to intervene and prevent all of these. Next, please. Our systematic review, go back one, please. Our systematic review, this triangle, a diamond in the middle, shows that 3 essential components of a core package can dramatically advance our ability to prevent these adverse consequences that are shared on the right. Cash transfers plus parenting support, psychosocial parenting support, plus sexual violence prevention and health services. Next, please. Let me just close by saying our global reference group affected by crisis launched to generate data, action, and advocacy to strengthen the capacity of national and local responses to children affected by crisis. And there you have on the bottom our website that will be at your disposal. Next, please. I'll go ahead and turn it over to the next 4 speakers. Will speak in turn and will give you a brilliant overview of the data and its implications from the United States. We'll hear from Oliver about 10 minutes, then from Oliver Ratman from Imperial College London. Then we'll hear from Jean-Pascal Ntoile from University of Edinburgh, and he'll give an overview on Africa. Then Dr. Eddie Unwin will give an overview of our findings in Brazil, and we'll close off with Sydney Tucker from University of Oxford giving findings from Columbia. I'm not sure I mentioned Eddie. I'm not sure I said that Eddie is from University of Bristol. I meant to, but I'm trying to make sure I keep my time as I'm trying to keep everyone else to their time. Let's go over and turn it over to you and welcome Ollie.
Thank you so much, Susan, for this really kind and good introduction. I shall also say, please post in the chat for any questions that you have, and we will try and answer them as soon as we can. And following up on what Gillian said, let me highlight that the purpose of this US analysis really was to provide a comprehensive estimation of orphanhood and caregiver loss and go beyond existing limited estimates that were cause-specific, say by COVID-19 and HIV. Next one, please. So we defined orphanhood as children aged 0 to 17 years that experience the death of one or both parents, so following the UNICEF definition. We also, in addition, considered primary grandparent caregiver loss and secondary grandparent caregiver loss. And primary grandparent caregiver loss was defined as co-residing grandparents who live with their children aged 0 to 17 years and were responsible for most of the basic needs of these children, either in the presence of one parent or in the absence of both parents. And in addition, we considered secondary grandparent caregiver loss. So that was co-residing grandparents who lived with their children aged 0 to 17 years, didn't necessarily provide for most of the basic needs of the children, but at the minimum provided the housing either by rent or through ownership. Next one, please. And we adopted a data-driven comprehensive methodology to estimate orphanhood and caregiver loss that was based on population-based near-complete death records and birth records. To quantify grandparent caregiver loss, we also considered survey response data from the American Community Survey. Next one, please. And I wanted to share a little bit of the basics of how we did our calculations. So we considered the number of people who died in parenting ages that was stratified by subgroups, race and ethnicity, state level, and so forth. And then we multiplied the number of decedents with the estimated average number of children in this subgroup. And that is how we generated the orphanhood estimates. Next one, please. Our key findings for 2021 are that an estimated 2.91 million children, so that's a prevalence of 4.2 children in the US, had lost a parent, primary or secondary grandparent caregiver before reaching age 18. And that is an order of magnitude larger than any previous cause-specific estimate. We also found that caregiver loss incidence rates increased from 2000 to 2021 by 56%, and prevalence went up by nearly 8%. And that is in the context of ever-increasing medical care. And thirdly, populations disproportionately affected by orphanhood were, according to our findings, adolescents, non-Hispanic American Indian and Alaska Native children, non-Hispanic Black children, and children in southern and eastern states. Next one, please. And we try to understand where this increase in caregiver loss incidence rates is coming from. And having cause-specific death data of the parents who died, you can see in the colors the top causes that we identified underpin orphanhood in the United States. And in dark green, you can see how prevalence rates due to drug overdose in parents have dramatically increased from 2000 to 2021. We also see in the dark red the increases due to COVID-19 since the start of the pandemic in 2019. We also see increases in suicide, excluding drug overdose in dark blue, and increases in homicide shown in light green. And you can see that during the COVID-19 pandemic, we find that orphanhood was much larger due to drug overdose. It had escalating effects as well, that were increased much more steeply than COVID-19 as well. Next one, please. We then investigated what are the main contributors to orphanhood in the US in terms of causes of parental death, and how does that compare to the main contributors of death in the population in general. And we can see from this slide that drug overdose, for example, contributed 17.4% to orphanhood, but only 3.4% to deaths overall. And similarly, overall, we see that preventable causes, most notably injuries, drive orphanhood incidence and these increases that we've kind of seen across the US. Next one, please. We further investigated inequities and disparities by age, sex, and standardized race and ethnicity in orphanhood among US children. So first, we find that death of fathers is more frequent. Next one, please. Second, we found that adolescents experience orphanhood much more frequently than younger children. Next one, please. And once we started to stratify by age and race and ethnicity, as shown in this slide, we found that non-Hispanic American Indian and Alaska Native children are most affected by orphanhood, with prevalence rates as high as 9.2%. And that is pretty much on par as the prevalence rates that we've seen in early stages of the HIV epidemic in sub-Saharan Africa. So these are devastating numbers. And secondly, if you consider non-Hispanic Black adolescent children, the prevalence rates were as high as 7.0%. And if you consider non-Hispanic white children, that was about 5.9%. Next one, please. We also thought to provide a reference estimates at the state level to guide state level responses. And what we found that often the prevalence above 3% in children is pervasive across most of the United States. In 30 US states, drug overdose was the leading cause of orphanhood. And we found that the highest prevalence rates were in West Virginia, New Mexico, Mississippi, Louisiana, and Kentucky. And these are also the states that had the highest poverty ranking. Next slide, please. So to conclude, we found a very big number. 2.9 million US children experienced caregiver loss in 2021 in their lifetime. Next one, please. We also found that orphanhood has increased fast, more than 50%. We find a more than 50% increase in incidence rates of caregiver loss since 2000, and that increase is even higher if you consider orphanhood, where it was 62%. We also found that orphanhood incidence rates due to drug overdose escalated during the pandemic, talking about or reflecting the synergies and the joint burden that individuals were facing at the time. Next one, please. And as Susan has already alluded to, we know what to do from previous crises and lessons learned. My colleagues will talk more about the Prevent, Prepare, Protect model, the WHO Inspire package, prompt identification and linkage to services, as well as checkbox on death certificates approaches to find children in real time as quickly as possible. Thank you.
Thank you so much, Ollie. You did a great job, masterful job, and you stuck to your time so well. Jean-Pascal, we'll go ahead and turn it over to you to give us some flavor of what is happening with all-cause orphanhood in Africa. And I will highlight the importance of this, particularly in terms of the increased HIV risk and sexual violence risk among orphaned children. Go ahead, JP, and if you can, please turn on your video.
Yeah. So thank you for having me. I'll just briefly talk about the numbers of orphans in Africa and how these high numbers are quite linked to different crises, as Susan mentioned at the beginning. So we have, on one hand, epidemics or contagion in general, and also conflicts, and now climate change. So next slide, please. To give an idea of, we estimated the incidence of orphanhood in Africa. This is like the number of new orphans per year. And here we are showing the rates over time. So you can see that in the sub-Saharan Africa region, which was quite highly affected by the HIV/AIDS epidemic, you had at the peak up to like almost 5% of children being orphaned every year. And that these numbers were highly driven by the HIV/AIDS epidemic. So most orphans in these countries, which I highlight here, and were due to HIV/AIDS. So it's not the same context in every country, but at least in these countries, it's mostly HIV and AIDS. And this highlights already how devastating it can be. And this is not particular to HIV/AIDS. Even for COVID-19, we estimated that there were COVID-19 caused in Africa more than 2 million orphans just in 2 years. And that's something that we should keep in mind and think about, especially when tackling infectious diseases or pandemics, because often people tend to forget the long-lasting impact on children. Next, please. And now I will show you what the effect of the different conflicts can have on the numbers of orphans. So at the moment, there are ongoing armed conflicts, like in Congo, in the Democratic Republic of Congo, where I'm originally from, and in Sudan, and I think in the Sahel as well, in other parts of Africa. And just to have an idea of what the impact of those conflicts today will have on children, we can look at historically what other conflicts have had. And you can see that for countries like Rwanda, which is probably has seen the highest in terms of incidence, number of new orphans happening in a single year. That was in 1994 due to the genocide. And in that year, almost like 40% of children lost their parent, lost either one or both parents. But we don't have to think about that extreme case, even in smaller, relatively smaller conflict, like what has happened in the Central African Republic. So they've had like 2 civil wars, and actually it's still ongoing. So there was still a civil war between 2004 and 2007, and that caused that huge spike that you can see somewhere. That's CA Republic, that's Central African Republic, and all the spikes that you are seeing, they can directly be mapped to a conflict happening. And that's just showing us that conflicts can have a devastating effect on children. I mean, not that they die as all adults die, but they also lose their parents, and that will have long-lasting effects. Next, please. So overall in Africa, in sub-Saharan Africa, the estimate from UNAIDS show that there are more than 58 million orphans, and the country that has the most number of orphans is Nigeria. But in terms of orphans per capita, it's the Southern African countries that are affected the most. And I think I'll leave it there. Thank you. Yeah, and so finally, I was just trying, I'm aware that I'm probably out of time. So you can see the trends, an increasing trend in the number of orphans everywhere in all the regions in Africa, except probably in Northern Africa, but now it was a decreasing trend, but now it's going up. Thank you so much.
Thank you so much, JP. That was exceptional and eye-opening, and certainly should motivate us to act. Now we're going to go into a brilliant learning session, I think, for all of us, with Eddie Unwin speaking about what we have seen happen in Brazil in this whole area. Eddie, do you want to go ahead, please?
Yeah, thank you, Susan. And so we're going to be focusing on Brazil in these 5 minutes. We're using very similar methodology to that that was presented to you by Oliver Ratman and Jean Pascal. Next slide, please. What was really great about this study is that we had both data to enable us to do modeling, but also some registry data, which was counts that enabled us to do a comparison between what we found by modeling and what we found by this count data. So what we've been using for this study is estimates of all-cause death. With this, we were able to look at both all causes, and also we managed to take a subset of this, which was COVID-19 associated deaths. So we were looking at the period from January 2020 to December 2021. As well as deaths, the second piece of data that we needed was information about fertility. And we got live birth data from women from the SINASC dataset, and male fertility and grandparent caregiving information from the PNS survey. But we also got two registry or 2 pieces of count data, and this was the civil registry data for children aged 6 or under who lost parents or caregivers. Another speaker today, Andrea, looked at death certificates in the Campinas region. And we were able to use this to compare to our modeled estimates. Next slide, please. So what do we find? We found that 1.3 million children were affected by loss of one or multiple parents and or grandparents or older kin. So the two figures on the left-hand side, these are focusing on raw totals, and the figures on the right-hand side are rates, so affected children per 100,000. So if we look at the figures on the left, what we see is that the worst affected states were the states with the highest population, so places like Sao Paulo and Rio de Janeiro. But these aren't the states that were most affected when we consider population, and we found that incidence rates got up to around 17.5 per 1,000 children in the state of Roraima. Next slide, please. So as I said earlier, what was really great about this data set was we were able to compare our modeled estimates to data counts. And on these slides are two images focusing on comparing us to registry data. So for our estimates, we were able to look at children from the ages of 0 to 17, like the study that Oliver presented. But this registry data was only for children under 6. So we just subset our estimates to look at those. So what we did in the first slide is we looked at how orphanhood changed through time. And you can see that there's quite good agreement between the red and the blue, where the red is our modeled estimates and the blue is the civil registry data. So through the period of our study, we were getting good agreements about when the orphanhood was occurring. But what we noticed from the bottom image, that there's a real discrepancy between the magnitude of the problem. And you can see what we've plotted is the monthly orphanhood for the registry data, which is the blue bars, which are much smaller than the our estimates. And this is again something that we saw when we were comparing our data to the information that Andrea collected from Campinas, that there's a big discrepancy between kind of the estimates that we think that there are and the numbers that are being picked up on death certificates. So something like a 50%. We're getting 50% more children through our modeled estimates. So some encouragement to keep collecting this registry data. Next slide, please. And we've just published this as a preprint on medRxiv, and here's a link. Here's a QR code for that paper. Thank you.
Thank you so much. Can you go back one slide, whoever's running the slide, please, just a second. This bottom slide, thank you so much, Eddie, ties in perfectly to what Sydney is now going to present, because you see that the death certificate data that Andrea will talk a little bit more about at least does help us identify in real time children who are being affected so we can find them. The red model data gives us an idea of the magnitude of the problem, but of course the aims would be identify all of those children, assess their need for assistance, as Gillian talked about in the very beginning, and get it to them as they need it. Next slide, please. Next one. Okay, now Sydney, please go ahead and give us an update on the data from Colombia, and we look forward to hearing a little bit later from Dr. Stephen Arroyo, who will link this to some policy implications. Go ahead.
Thank you, Susan. So I'm sharing today about the OK program, which is addressing orphanhood and caregiver loss in adolescents and young children in Colombia. Next slide, please. So this program had two primary aims. The first aim was to answer, how can we estimate the number of orphan children and identify these children in real time? And to do this, we modeled orphanhood estimates using national fertility and mortality data, and we evaluated an adapted death certificate, as Eddie and Susan have shared about in Brazil, which indicated when deceased individuals had one or more child. And our second aim was related to this. We knew that once we identified these children, we had to be ready with resources which could strengthen them and their new caregivers. So our second question was, can we protect orphan children by strengthening next of kin caregivers through delivering an evidence-based parenting program? Next slide, please. So I want to first start with sharing the data that we found. So you see here orphanhood incidence over time in Colombia. And what's really clear is that incidence has been increasing each year since 2019. And we see this increase in female caregiver deaths, but we see it even more in male caregiver deaths. And in 2021 alone, it resulted in 100,000 children losing either a mother or a father or both. Next slide, please. So overall, we see almost 650,000 children who have been orphaned in Colombia, and that's 4.5% of the child population. And secondly, the leading cause of this parental death is not COVID-19, and there was 2.8 times higher orphanhood from all causes compared to from COVID-19. And then lastly, from being able to identify these children in real time, what we learned is that 2/3 are hungry, 2/3 need mental health care support. And lastly, importantly, orphanhood incidence and prevalence were highest in the poorest regions of Colombia. Next slide, please. So I want to go on now to what can we do about this? Are there ways that we can strengthen children who've lost a parent or caregiver? So our first step was to contextualize an intervention called Hope Groups with Colombian parents and experts in these local communities. So Hope Groups originally is a parenting intervention that was created for parents affected by the war in Ukraine. But with Colombian leaders, we adapted Hope Groups to be broadly for crisis and also specifically for children who've been orphaned and for next of kin caregivers. And to give you just a summary of what this intervention is, Hope Groups are a 10-session mental health, violence prevention, and parenting skills building program for caregivers. Next slide, please. So the amazing thing that we found is that through implementing this simple parenting program, we could see meaningful differences in the lives of orphan children and next of kin caregivers. So I'll show you just a sample of the results here. We saw 76% reductions in caregiver depression. We saw almost 70% reductions in emotional violence against children, and we saw over 80% reductions in physical violence against children. And importantly, we also saw 73% decreases in child behavioral issues. And I'll share just 2 quotes from participants who participated in this intervention. The first is from a caregiver. And the caregiver said, "We never thought that children also experienced grief. They never expressed feelings, they simply misbehaved. Now, though, we understand that the 7-year-old son is expressing how much he misses his dad." And then secondly, a child who was in the family with a caregiver who participated said, "First of all, I want to thank you because these exercises have made me feel better. When I put them into practice, my world changes, everything is better. Thank you." Next slide, please. So lastly, I just want to close with 3 things. The first is, in Colombia alone, there are 650,000 children affected by orphanhood, which is 4.5% of children. And in Colombia specifically, we're only talking about the deaths of mothers or fathers, not grandparent caregivers. And many of these children are both hungry and need mental health support. The need is enormous. And secondly, the good news is there is something we can do about this. Parenting programs for next of kin caregivers can strengthen caregiver mental health, improve parenting practices, reduce violent discipline, and improve child well-being. So lastly, there's urgent needs both for identifying orphan children in real time and linking them with resources, which can ensure these children are supported now and can also flourish into adulthood. Thank you very much.
Thank you so much for the group of speakers who gave us some information about the data. You just did a wonderful job. Well, let me get this to stay on. showing the magnitude of the problem. And even Sydney, it was so refreshing to see you ending with the fact that you can do something about it. And I want to just call attention and honor to University of Sucre, who participated in this and really is responsible for the exceptional leadership in showing that you actually really can identify the children, assess them, and link them to assistance. I'll now turn it over to Laura Rawlings from University of Georgetown and the World Bank, who will give an overview of the three-pronged approach that we've been developing as a global reference group, and then proceed to turn it over to Philip, who will introduce you to the policy panel. Thank you so much, Laura.
Thank you, Susan. Thank you, everybody. It's a real pleasure to be with you today. Let's just go to the next slide, please, where I want to recap a little bit about what we've just heard as a preview for focusing on policy responses. We have heard about how, particularly in the US, but also in Colombia and Brazil, deaths of despair are often driving orphanhood, perhaps even more than disease. We have also seen that there are sharp disparities within countries in health and orphanhood rates associated with sharp disparities in poverty and vulnerability. In other words, what we're increasingly seeing is that the drivers of orphanhood are often exacerbating the consequences of orphanhood. These problems need to be addressed. In addressing them, we need to understand that there are differentiated impacts and risks linked to age, gender, and ethnicity, both of children and of their caregivers. And we have seen that polycrises are present and often compound vulnerability, be it around climate, conflict, or contagion. Fortunately, we can draw from a growing literature, particularly based on robust evaluations that can provide solutions. And these have been developed particularly through lessons and applications that have been derived from responses to the HIV/AIDS crisis, the COVID crisis, and situations of fragility and conflict. If we go to the next slide, this is an overview, and I will then spend the last few minutes breaking it down, but it is an overview of solutions, of what it takes to address the orphanhood crisis. So we at the Global Reference Group have come up with this three-part model, prevent, prepare, protect, that is important in guiding policy responses to ensure that children reach their full potential in safe and living families, and to address the orphanhood crisis. So prevention is focused on accessible, equitable primary health care. This is an area that the World Bank is committed to expanding as one of our key prerogatives, and that this should include a focus on mental health and psychosocial support. There also is a need to address vaccine hesitancy and to focus on prevention of violence and abuse. The second area, the prepare area, is about preparing for family-based services, particularly to avoid institutionalization, such as orphanages, that we know can be detrimental to children and their development. So this involves building up safe, supportive, family-based kinship care, fostering, or adoption, as well as strengthening case management and child protection systems. Last, but certainly not least, there needs to be a very strong focus on protecting children from poverty, adversity, and violence. I will spend more time on this subsequently, but just to touch on some of the key areas, which include evidence-based cash plus care programs, grief and mental health counseling, age and gender-sensitive social care services, and violence prevention and life skills. We need these investments to be coordinated in a common agenda that call on a range of stakeholders to mobilize across social workers and the services that they provide, private, NGO, and faith-based communities, accessible early childhood development and childcare, accessible and quality education, public health, and safety nets. Next slide, please. I'm now going to go through 5 evidence-based interventions that we know work to support families and protect children and can be mobilized to address orphanhood. The first one I want to speak about is one around preventing violence against children, which is the INSPIRE framework that has been developed by a range of academics across the institutions listed below that list these 7 areas that we know are important for addressing violence against children, that span legal areas, norms and values, safe environments and parent and caregiver support, income and economic strengthening, response services, and education and life skills. The second area, to dive into it a bit more, and next slide please, is around cash plus care services. These services combine income support with a range of care services, particularly parenting support. And we have shown that these cash plus or cash plus care initiatives have been effective in positive changes, large changes in improving mental health and school progression, and changes as well in reducing violence, abuse, and high-risk sex. Next slide, please. Cash plus care approaches are very important because we know that income support alone is not sufficient to address vulnerabilities. And the elements of cash plus care approaches that are quite critical are really threefold. They focus on systems strengthening, first strengthening social protection delivery systems, for example, investing in dynamic social registries to identify orphan children and caregivers, including civil registration and vital statistics, as we saw earlier, strong monitoring and evaluation, appropriate legal, institutional, and fiscal frameworks, and demand support to families, including cash transfers, parenting support, and jobs and economic inclusion programs, and supply-side support for the institutions that provide services to children and families, including strengthened health systems with mental health support, strengthened education systems, including counseling and outreach to support children and their families, and to provide educational and early childhood services, strengthen social work and collaboration with these communities. Next slide, please. The third area that I want to touch on is the importance of social care services. These include a wide variety of programs to support individuals and families in assessing risks and improving their well-being. And they include a broad group of the social service workforce that can be from public, private, and non-formal actors. There's essentially a 3-tiered system in social care services, beginning with foundational social work, including information and awareness, referrals and counseling and intermediation services. There's a second tier that is typically provided for specific population groups, including children, and can be delivered through home-based, community-based, and institutional locations. And the third layer is specialized services developed by and provided by trained professionals in the area of mental health, legal services, gender-based violence, and social protection. Next slide, please. These are overarching principles in social care provision that I think serve as a good reference for anyone working in this area. Next slide, please. The next area is around parenting programs, and I just want to point out here that there is has been an explosion in evidence over the past 20 years on what are effective parenting programs. And this includes randomized control trials from not only high-income countries, but very importantly, lower and middle-income countries. So this is evidence that can be mobilized and combined, for example, in cash plus care programs to address the risks and vulnerability associated with orphanhood. And next slide, I want to focus in on one particular program that is a parenting program that is a hybrid program that has combined in-person and digital parenting. And these approaches are growing in terms of their use and estimates of their effectiveness in the global north as well as in the global south. And in Tanzania, this hybrid program was delivered at a low cost of $6 per family, and an evaluation of almost 5,000 families showed that this hybrid parenting program improved, that was designed for adolescents and their parents or remaining caregivers. These were designed with very good results in terms of mental health, in terms of economic coping, in terms of parenting, in terms of violence prevention, and in terms of gender transformative results. Next slide, please. I want to end where Sydney left off with a focus on the Hope Groups as another particular intervention that is an evidence-based mental health, positive parenting, and violence prevention intervention delivered through local support groups. This has been applied in Ukraine as well as a number of other countries. But in Ukraine, the Hope Groups have served over 3,000 Ukrainians across 15 countries, providing care to over 6,000 children. And on the next slide, we have been able to see positive results from the Hope Groups, showing that these have been effective when delivered either via mental health professionals or lay-trained individuals, that they have been effective among different populations, including externally displaced people, internally displaced people, or those that are at home in war-affected areas, and that they have been effective both as an in-person or a virtual or a hybrid delivery modality. The improvements from the Hope Groups are notable in that they have resulted in improvements in all three domains of parent mental health, of parenting practices, particularly in violence against children, and in terms of child well-being. I'll just conclude with a last slide, thank you, on our takeaways from this work and what it says about the importance of how to craft evidence-based policy responses. First of all, it is to focus on those evidence-based programs and to make sure that they include cost-effectiveness estimates, because this is going to allow us to understand what works. Second is that implementation science needs to continue to be an area of focus. This is what will allow us to understand why certain things work, how to sustain them, how to scale with fidelity in terms of the effective programs that have often been studied as smaller, more closely managed randomized controlled trials. Third, that we need to focus on crisis preparedness and response, and the prevent, prepare, protect framework is very interesting and effective in this fashion. Fourth, that we need age and gender sensitive approaches, both for parents and remaining caregivers as well as children. And last, but certainly not least, that these responses need to be rooted in family-based care, mobilizing community support. Thank you very much.
So I guess I will take it from here. I'm Philip Goldman with Maestro International. Thank you, Laura. That was the perfect introduction to the panel that we're going to have today, and what an excellent panel it is. Please stick around for them. I'd like to set a little context before we get into their individual country presentations, and stepping back from all of the work that we've heard presented thus far. There's a huge conundrum for me that I wrestle with a lot, and those of you who know me know I wrestle with this a lot. On the one hand, we know that when children are in safe and nurturing and protected families, the payoffs are huge, and the payoffs are with respect to their physical development, their cognitive development, and so forth, and their overall well-being. their education status, their lifetime health status. With time and as they grow into adulthood, their likelihood of being able to secure work and to be compensated at a higher level. There's all sorts of evidence from early childhood and beyond suggesting that setting up social policy systems that are focused on the welfare of children makes sense for societies. They contribute to long-term poverty reduction and economic growth and social cohesion and less violence. So you would think, and here's the conundrum, that most governments and societies would be investing in child welfare, investing in the kinds of responses Laura was just presenting that are needed, that we need comprehensive services, we need economic and social supports, cash plus care pulled together. And it's to the benefit to our communities and to our nations over time. But when we look at it, that's simply not the case globally. Here in the United States, I was just at a congressional briefing yesterday, and we heard all about, as far as we've come in well over 100 years, well, since the late 1800s, and developing a child welfare and foster care and adoptive system here and child protection, how far we have to go. But then when you look at the rest of the world, you're hard pressed to see children's policy and child protection and the issues we're talking about today reflected centrally in social policy as a key principle or a tenet of social policy, complementing health and education services. Even though were we to invest in that, we would have much better health and education outcomes. If you look at budgets, as we have many times, you don't see the government budgets really coming in and putting the resources in that are needed. And instead, you see billions of dollars from the US and abroad going into supporting residential care for children, orphanages, children's homes, all kinds of institutions that, as you've heard, are not to the benefit of children. So we're not getting it right. And that's why, we really want to turn to this panel to hear more from them about specific country and national experiences that can inform us about where they are and where they see the direction moving forward. And how do we get a more focus, more of a prioritization on these issues in all of our work. So I'm pleased to introduce our first panelist, Karen Phillips, the Associate Director of Restore Hope. And Karen, I just wanted you to maybe jump in and talk about maybe some of the gaps in policy and program needs here in the United States and the implications of the research and policy work that has been presented for the US and the work of Restore Hope. Thank you. Why don't we go ahead and move to Emma and Karen, don't despair. We'll come back to you in a bit if we can get the audio and video set up there. So Emma, your collaborative has been working, Emma, I'm sorry, she's Vice President of Programming with the Children's Collaborative for Healing and Support. What a great name for your organization. And you've been working directly to ensure that children and families experiencing parental and caregiver loss are receiving the supports that they need. I wonder if you can tell us a bit about this work and what you're learning from it.
Yeah, thanks so much. So in the last couple of years, we've worked directly with the state of Utah to actually tackle some of these problems. The foundation of our work begins with identification. So we've worked with Governor Cox to add a bereavement checkbox on the death certificate, and this took effect immediately, which allows the Department of Health and Human Services to actually track the number of families experiencing the loss of a caregiver. And this automatic mechanism ensures that we can connect those bereaved children with families from the onset and get them to the resources that they need. While we know the checkbox can allow for identity of children in real time, we also wanted to support families retroactively. And so we adapted school enrollment forms in the state of Utah to include a standardized question about bereavement. And that allowed students and families to have identified for themselves that they've had a loss of parental or caregiver, and then inform the school so that those young people and their families can be connected to resources. We also then train the school, from bus drivers to principals, in how they can be recognizing and supporting students that have been affected by loss. We've then worked directly with the Department of Health and Human Services and the United Way of Salt Lake to develop a care navigator system. So once a child has been identified either through schools or through the states, a mailer is sent out to that family with a phone number in which they can reach a real live person, someone that can directly connect to them with emotional and financial resources. And this opt-in model respects the autonomy of families, but makes sure that they can get the support they need. Through this work, one of the biggest learnings that we've had is the importance of funeral directors and funeral homes more generally, because they fill out about 95% of death certificates in the state of Utah and of states nationally. So that means that if you can get the funeral directors trained and informed on the importance of the checkbox on the death certificate and the resources available to families, they can act as a direct connection between that identification and then those supports that the families need. We've also been working with the Social Security Administration to simplify the process of getting access to survivor benefits. So we've been advocating for an online process so that families can navigate what is normally a challenging process to get resources. And so we're really excited about kind of these 4 interventions. The first, the checkbox on the death certificate. The second, the intervention through schools. Third, the training and development of a case navigator system. And then fourth, the working to connectly direct families to resources. And we think that this can be applied to every state. So we're excited to see how we can move this nationwide. Thanks so much.
Oh, that's fantastic, Emma. Thank you so much. And I particularly honed in on just making this so visible through the checkbox so we know the scale of the problem and how to address it. I'm wondering if Karen is back on the audio.
Hi there. Yes, sorry about that.
Gotcha. Okay, go ahead, Karen.
Yes, so I'm Karen Phillips with Restore Hope, and in 2016, Arkansas, the state that I am from, had the fastest growing prison population in the United States. There was one hardest hit area in Arkansas. It was Sebastian County. It's where I am located. It's where opioids first started hitting hard due to globalization, large plants were moving out of the country. A lot of people lost their jobs. We had a very high arrest to conviction rate in our area, and so people were, people were dying from overdoses. Others were getting caught with illegal substances and going to prison, and parents were absent. That meant, and kids were going into foster care by the groves. At the time, 27 kids per 1,000 were in foster care, and the national average is 5. So out of pure desperation, we came up with a model that incorporated all of the collective impact requirements into a response that first addressed family reunification, but then moved upstream into prevention. So this model addresses those 3 Ps that were talked about earlier: prevent, prepare, protect. The 100 Families Initiative is what we call this initiative that brings those 3 components together. It is a community-led initiative, so we make sure that we use collective impact collaboratively with the community to help struggling families move out of crisis into stability and onto a career and thriving lives. And we do that using the existing community resources, including the assets in the community, which are the people. So we engage those people and organizations into a community alliance. We use a shared assessment and measurement system. It's called Hope Hub. It's a collaborative case management system across different sectors. And then we train frontline advocates to respond whenever a family is in crisis, no matter where they pop up, whether it be the prison system, the district courts, the homeless shelter, child welfare office, any of those areas where a family in crisis might end up either by requirement or by seeking services. And so the community that this began in now has the longest running data for the initiative, and we've ran it there in that particular county for 6 years. It has seen population level change. In the 6 years since the initiative began, there has been a 50% reduction in foster care. There has been a 50% reduction in opioid overdose deaths, a 30% reduction in incarceration in this community, and a 20% reduction in crime. So outcomes for families have also been outstanding, with increases in every one of the 13 areas of social determinants of health that we capture data on. So from employment to recovery, mental health, transportation, legal issues, childcare, 13 different areas, safety. And of the 3,314 families that have been served in the last 12 months in Arkansas specifically, there has been a 79% increase in housing stability, a 50% increase in full-time employment, and a 24% increase in mental health stability. Another key area we have seen some outstanding results is whenever a child gets placed into foster care, for example, they are very unlikely to ever be reunited with their parents. In Arkansas, it's a 43% chance that they'll get reunited. But whenever they are connected to this community model and multiple providers helping them simultaneously and corresponding their work together, aligning their activities, that increases to a 68% reunification rate across the board.
Wow. Thank you so much, Karen. That's amazing. I think just for us to see what and hear what's possible inspires all of us to keep working on this. Back over to you, Philip. But thank you so much, Karen.
You're welcome.
Karen, those numbers are amazing. We got to bring you to scale. That's all I can say. And I think it has something to do with your holistic approach that you described. Quite amazing. Thank you. I'd like, again, please write questions in the chat. I don't see any. Otherwise, the questions are going to come from me. And we'd rather hear your questions. Now, on to Colombia. Arturo Harcaroa is on the faculty of the School of Government at the Universidad de los Andes in Colombia.
You know what? Excuse me, Philip, I think you didn't get that. We have someone different. It's Dr. Stephen Arroyo from University of Sucre, who's helped lead the Sucre work. Arturo could not join us, but Stephen is here. Sorry, I guess everybody else, but you got it. I'm so sorry.
Well, I'm glad you corrected me then, because otherwise I would have been very confused. So, Stephen, welcome here, and I apologize for missing that. But we did hear the data from Sydney earlier, and I wonder if you can give us some of your perspectives on the policies, programs, and services that are present in Colombia or that are needed in Colombia to really move forward on the 3P agenda.
No worries, Philip. Thank you. Thank you for that. Yeah, I can share with you some of the policy focus we have given to our project, the OK project we're currently developing in our country, in Sucre specifically. We have focused on basically establishing institutional partnerships for the protection and well-being of bereaved children. We have three main actors that we have tried to reach and establish those institutional partnerships. The first one is the Social Prosperity Program offered by the national government of Colombia. This program basically gives economic benefits to families in need. So we have managed to establish a direct communication channel with those responsible for the entity's social programs. We are working so that the data we have collected on the socioeconomic conditions of those families and the orphan children would allow them to be considered as beneficiaries of the different economic support programs they offer. They do have programs especially for young children, for young teenagers going to school or university. So we are trying to get involved those families we have identified into those programs. So I was telling you, this effort sets precedent for future initiatives in Colombia. aiming to integrate early recognition of orphanhood with state protection policies. We also had the methodology of modifying the death certificate to identify those families where a caregiver has, children have lost a caregiver. Due to the data protection law in Colombia, it was very challenging to work with funeral homes. So we came with an alternative of establishing an agreement with education secretary to work with public schools also. We have access to all of the public schools in our city, and we see that the close relationship between the school directors and coordinators with the child population is actually proven to be a valuable resource for detecting and assisting these cases even more quickly and efficiently than with funeral homes. So we're currently exploring the possibility of including a specific field for orphanhood in the student registration system. This would allow a continuous monitoring of the situation and ensure a timely response to any vulnerability cases. Additionally, we aim to train the school personnel so they can provide basic support and refer cases to specialized services whenever it's needed. This would also ensure the long-term sustainability of the project's impact. The third key actor that we're aiming to work with is the senators and politicians of our country. We're in talks and we have engaged in very productive dialogue with key senators to include a specific section in the domestic violence legislation, which recognizes the situation of our children and ensures an appropriate protection measure. This proposal seeks to expand the scope of the existing law, guaranteeing that children who have lost their caregivers for any reason would receive the necessary assistance for a comprehensive well-being. Right now, these existing laws are for women and domestic violence against women. So we are trying to expand it to children who have lost a caregiver too. Basically, throughout the collaboration of those government actors, the social prosperity program, the schools and the education secretary and the legislative power, we have seen a viable path to improve the situation of these minors. Challenges remain significant. However, I think we all think we're on the right track to make something really impactful in Colombia. So thank you all.
Thank you. Thank you so much.
Yes, thank you. That was fantastic. Having just come back from the Violence Against Children conference in Colombia, I can tell you a lot is going on there, and we really appreciate you sharing that. Now on to Brazil. Andrea Santos Souza from the Instituto do Câncer do Estado de São Paulo. Andrea, we heard from Eddie on the data, didn't we? And I know Brazil has spent many years building up its social protection system. I wonder if you could comment a bit on the agenda there and on some of your work.
Okay, thank you for having me here, and I'm so proud and happy. To the brilliant presentation by Eddie, I will just want to add 3 points due to the little time I have. Well, first of all, COVID shed a light to the phenomenon of orphanhood in Brazil. And the coalition now was formed with researchers and workers on the theme from different sectors that is still mostly raising awareness to orphanhood as a situation of unprotection to children. And now this advocacy has spread to all causes of orphanhood, not only to COVID. And especially as said before, my colleagues said before, especially domestic violence against women and urban violence that's unfortunately very big here in Brazil, that kill people every day and leave a great number of orphans. And this number in the city I work, I can say it's greater than COVID. The national, this is the first point. So there's this reunion of forces to work together with a team of researchers from every different specialities to deal with this phenomenon of orphanhood. The second point is that our National Judiciary Committee that coordinates all the national judiciary system of all 27 states. Brazil is a very large country, very different regions, and etc. So they issued an order now that this national committee coordinates the national judiciary system and the civil registrators, the notaries that have the death and the birth certificate. So they issued an order that besides having the name of the deceased sons in the death certificates, that this is a practice that's done by law since the 70s. Now every birth certificate must be filled with the parent's national number. That it's a special number we have here that's something like the Social Security number in US. So through cross-reference of this data, it's easy to find the orphans, even if they didn't live with the deceased by the time of the death, because this is the problem. Identify the orphan and find these children, because not always they lived with their deceased parents. We still don't have ways to find the children that lost a secondary caregiver. This is very difficult. It's something that we have to approach later on. So this is the second point. And then the final one, it's that we have a National Committee for Children's Rights that also supervises all the public policies. We have a national committee and state committee and municipal committees in the 3 levels that supervise the public policies. So the national committee issued a new recommendation just last December with the guidelines for public policies to grant protection to children in situation of orphanhood, including all causes, not only COVID. These recommendations must be followed by the national government to improve the public policies. And I don't have time to detail them, but they are mostly all the actions that were presented here to prevent and face rights violations and violence against these children. Now we are working to have similar recommendations in the state and municipal levels. So we can be sure that public policies will be addressing orphanhood in a very proper manner. That's what I have to just to add for the brilliant, and I want to congratulate everybody for this beautiful opportunity we are having to discuss this theme. Thank you.
And I would like to congratulate you for your excellent presentation on Brazil. Thank you. It was fascinating. And now finally on the panel from Africa, Chris Desmond, professor at the School of Economics and Finance at the University of the Witwatersrand. Chris, I've known you for a few years, and you have a pretty long track record of analyzing social policies in sub-Saharan Africa. And I'm just wondering if you could speak to the implications of this research for your work.
Sure, Philip, thank you. I'd be happy to do that. So I was asked to talk about an African policy perspective, but obviously given the scale of the content, I can't talk about specifics. They're too varied. So rather, I'll raise a few issues which I think are relevant in the African context when considering policy responses. So the question I'm really trying to ask is, what do we do with that huge number that JP shared with us? 58 million children having been orphaned. It's a phenomenally large number in a continent with very limited resources. And it gets a lot more complicated when you begin to think about it, that it's set against the backdrop of multiple acute crises and chronic crisis. So we're facing conflict, we're facing pandemics, we're facing chronic poverty over a long period of time, which places all sorts of children at risk. And so how do we deal with this elevated risk that comes from orphaning at such a large scale? So the way in which we've been thinking about it is, if you can imagine that the pyramid that we have here on the slide, is that you can think about what children need. So for most children within families, they don't need a great deal from outsiders. They need the systems that are there to support families, so education systems, health systems, safety and security, and so forth. Some families might not have the adequate resources, so there's a group of families in every society which need some additional support, and that's where social protection comes in, cash transfers, and so forth. And then there's a smaller group of families that typically where something is going quite wrong, and that could be related to death, it could be related to substance use, mental health, and so forth, and they need far more services, and that relates to social work and so forth. And that group's typically the most neglected, particularly in the continent where we have very weak investments in social workforces. Now, when a crisis hits, it leads to orphaning, it leads to other challenges for families and children. That pushes the top two groups downwards. So it means more families are now in this group needing acute services, and more families are in this group needing some additional support, such as cash transfers. Now, if we've been in a situation where you have underinvestment in those systems, or you are facing cuts in foreign aid and limited support, then those drops are likely to be even larger. And so we would see it pushing down to covering more and more of the families. So when we have these large groups of families at risk, how do we take on board this particular risk associated with orphaning? Now, what I would argue that it should be used to promote urgency. It should really increase the urgency with which we respond to children. Orphans need some particular services, but it also highlights the general issues and the general need for children in this context, and should increase our urgency in the way in which we respond to that. And we need to be quite aware of the need to push for that. So while acknowledging the specific needs of orphans, to not allow it to be used as a tool to narrow focus. Policy office holders, they often like an excuse to narrow focus. So now we can focus on orphans as opposed to this larger groups of children in vulnerability, and that needs to be resisted. We need to acknowledge the specific needs associated with parental loss, but we need to see that within the larger context in the African situation of many children in difficult circumstances, and not have it be allowed as an excuse to narrow in the response. And similarly, we cannot allow a response which narrows to children. It's very popular in policy responses to think that we have to protect children, this innocent group, and then we deny the role of the family. Now, there's no way that you can care for children at a distance. It just doesn't work. Children's needs are changing at all times, and the only people who can provide support to children are families. And so we have to recognize the role of the family. Now, even in the case of orphaning, there is always family around, almost always family around of some sort that is willing to take care. We are not short of people across the continent who are willing to take care of children, but they're often the resources and the supports necessary to do that are not there. So what I would be arguing for is really a policy response that is based on trust. So firstly, and most immediately, trust in the family, is that we have to acknowledge the importance of the family in children's lives and look for the ways, and many of them have been discussed earlier, of supporting the family in order to provide that care to children. And it's often quite difficult, and we do see resistance to that. That's why we see these massive investments in institutional care, for example, because it avoids having to trust the family. And one of the reasons I would guess that it is that once you start having to trust the family, you have to acknowledge that the family is facing its own constraints. And that brings in a whole broader set of issues, which maybe many policymakers don't want to take on. But I want to push a bit further and say we also need to trust in children and their role in the future. So I think about responses to children, orphans, and other children living in adversity along a continuum. At the bottom is really children who are neglected. So we just don't respond to them. Then there's a response driven by charity, where we try and address the harms that those children are experiencing. It's a good thing. I don't mean to belittle it in any way, but it is only really trying to stop the harm that they're experiencing. Then there's a stronger level of support, which is really trying to empower those children, seeing the role in which they can take on more in the future. But the top level is ready to say trust, to trust that those children have a role in the future, and that we should be investing them in a level that reflects the potential of that role. Now, some people argue that's instrumentalizing children, but I would argue that we're all here trying to be instruments, and for children might have the same needs as we do. And so that really talks to a new scale of investment, saying that in times of austerity and in crisis, we should be increasing our investments in children because they will respond to it over the long term. We shouldn't be scaling them back. And I would say that we need to really link this to the larger debates that are occurring in the world, is that the world really has a choice at this time, that it's facing these crises, that it pulls apart or pulls together. And we're really starting to see the way in which it's pulling apart, and investing in children is really an opportunity to pull together, recognizing that those children could be finding responses that will help deal with future challenges as they increase. What that really pushes to is a need to move from a narrative which we have often adopted of minimizing harm, of finding the most cost-effective solutions, to a narrative that says we should be maximizing potential. And people respond that that's ridiculous in these times of austerity. But we have to recognize that the world is richer per capita today than it has ever been in its history. but we accept a narrative of austerity, which is absurd. So that's it.
Thank you so much, Chris, for your
Chris.
brilliant remarks to end us with. All of us are being inspired to live in the green and fight for the green. So, and thank you so much for Philip for some brilliant moderation. And I guess I'll go ahead and, is there anything else you wanted to close with before I move us on to closing remarks, Philip?
We had a little time for Q&A, but
Okay, let's go ahead and have a, let's go ahead and take some time for Q&A. Go ahead and.
I mean, should we try to end by the half hour? Is that the?
Why don't you take 5 minutes for Q&A and then let's go ahead and go to closing.
We have basically 4 questions, a bunch of questions about, can we please have a copy of the slides? That means that people really understand the importance of this data, so thank you. One question for Emma: how do school systems and teachers and bus drivers, how are they informed about children in their path need support? Can you expand more about how this happens and how you're able to get access to the schools?
Yeah, absolutely. So all the schools we worked in have opted in to this process. So they've raised their hand, they see the importance of identifying young people, and the process is fairly easy. The enrollment forms are changed directly by the district, and then they collect the data. Now, the training of all the people in the building, from bus drivers to principals, that happens independent of any knowledge about the individual children. So every adult in the building is trained in how to be grief sensitive, how to support students who may be having an emotional reaction or who share about a death in the family. And that is separate from the individualized data that is kept within just the counselor's office and then our care navigators.
Thank you. And the next question comes from Michelle. As far as I can understand the French, I'll do my best. And it's open to the panel. You've done everything possible that you can to find a living parent, a relative to care for a child, and you're an NGO working on the ground. And for whatever reason, you're unable to find that caregiver. What do you do? What's your next step?
I guess I'll go. So fictive kin is a very great second option. So looking at educators, at coaches, anyone that has been in that child's life, I think is that would carry on, both their location, their geographic location, because we get so many children that get moved out of county, out of state, and I mean that disrupts their not just the fact that they've lost their their immediate family, but now they've lost all their friends, their teachers, those that are very, very close to them. So so keeping, finding we call it fictive kin, finding those people that are close to them in their lives that that have a bond already with that child, I think is an important way to look next.
Thank you. And the last question, we're facing a changing global regime with respect to foreign assistance. Obviously, the United States has made decisions about USAID, but yesterday, the UK Foreign Cooperation and Development Office it was announced in the UK there'll be a more than 50% cut in foreign aid coming from the United Kingdom, some other countries. And one of our participants was just interested, how are these cuts affecting programs on the ground?
Yeah, I'm happy to comment on that. So, I mean, the cuts are profoundly serious. We are seeing loss of services, even where there are exemptions. Many times the exemptions are not coming through. And so this really affects all the levels of the systems that I was talking about there, for example. So we're going to see increases in the rates of orphaning, just as an example, as we see breakdowns in the treatment regimes. And we're also seeing increases in the problems that follow that, because we're seeing breakdowns in the support systems that are typically there in order to be able to mitigate those consequences. I mean, you can't really overstate the consequences of cutting such large levels of support and so abruptly. So if it was a slower transition, perhaps countries could step in, perhaps other countries could step in, but these abrupt transitions just throw everything into chaos and are causing monumental levels of suffering. From which it is hard to see that we will come back unscathed. We will have to figure out ways to deal with them, but the costs will be large.
Well, to the five of you, I have to thank you. It's on a more uplifting note. It does me good to know there are people like you working on the ground to make it better for children. Susan, over to you.
Thank you so much, everyone. We'll go ahead and turn it over to our last two speakers who will just summarize. Kirsten DiMartino from UNICEF, we are so appreciative that you can join us. And then we'll finish off with Ellie Oswald, who's the Executive Director of Faith to Action, who will complement Kirsten's remarks with the faith-based contributions. Go ahead, Kirsten, please.
Thank you so much, Susan, and thank you for inviting me, UNICEF, to this very important webinar. I've been listening very intently, and all the wonderful work that is being done to better understand the challenges that children without parental care face, both in the US and in other countries across the world. So I think we all agree here, I'm speaking to the like-minded, that every child should definitely be able to grow up in a safe and nurturing family environment. I don't think I have to explain it to those who are participating here today. What we do know is, of course, that in addition to the significant trauma that children experience when they lose their parents and caregivers, they are also then exposed to an increased risk of violence, abuse, and exploitation in many different forms. And then we also know that, of course, children who end up in residential care often face additional neglect, lack of individualized care, limited emotional connection, and again, another layer, another increase of possible risks of violence, which will affect their growth and development in the immediate and long term. So the number of children in all forms of alternative care is, in many respects, from what we see in all countries in which we work in, a reflection of a country's child protection systems and other allied systems that should be supporting children and families. Higher rates of institutionalization and child-family separation are usually a strong indication of a child protection system which is unable to support and keep families together. So in essence, it's a weak child protection system which requires more investments to support vulnerable children and families. I just received new data from our country offices literally in the last few days that I can share with you. And we have seen that in 2024, we have an estimated, and I'm saying estimated, 2.5 million children who are living in all forms of formal alternative care in 87 countries where UNICEF has programs on care and data is available. So there is a limitation to that data, right? It's not in all countries around the world. And again, there are challenges with data collection, etc. Out of these, we estimate that about 1.5 million of these children are in family-based alternative care. That is, they are in formal care, but they're not in residential care. So this is data that we have just received from our country offices. We're looking at it more closely, so with that caveat in mind, but it just gives you an idea of the kind of information we are receiving from our colleagues in the ground. And this data, of course, comes from administrative data sources and our work with the governments and countries we work in.
Thank you so much.
Yeah. So just to go on, just to be, not to speak too long, I know we have short time, but to say that, of course, we work across many countries to support care reform, children's care systems, and to gather those lessons learned and good practices. And we do have what we call a three-pillar approach, which is very much the line actually with your three-pronged approach that Laura described before around prevent, prepare, and protect. Our approach is precisely about preventing the separation of children from their families. Secondly, prioritizing family-based alternative care when it is necessary and paying special attention to children with disabilities and unaccompanied and separated children, especially in humanitarian contexts, who are disproportionately impacted. And the third pillar, so to say, is ending institutionalization and promoting family reintegration. So very, very similar. We do see that this requires a very comprehensive child rights-based approach to care reform, one that looks at systems that can provide a comprehensive continuum of child and family services that are very tailored to the support and care and protection needs of children and their families and caregivers. And to advance this agenda globally, we essentially work around 4 key broad areas of intervention to bring about transformative change. First of all, we support family strengthening and community-based programs and services that support parents and caregivers, prevent family separation, and strengthen the resilience of families, including through the sort of an integrated approach to cash, care, and casework. And this is also what Laura mentioned before. We see that addressing income vulnerabilities is just not enough. We need to provide care, and we do have to do careful case management to ensure that children are connected and referred to appropriate services and support. We also need to invest in a dedicated and well-resourced social service workforce for child protection. And the reason for this is an area that is completely lacking in many, many countries. Many countries don't have social workers. They don't have frontline workers who can support vulnerable families and children with the knowledge and skills in gatekeeping, parenting, counseling, mental health and psychosocial support, early childhood care and development, case management, how to address harmful social norms, etc., and much more. So we really need to invest in this dedicated social service workforce for child protection at the community levels, as they play really a critical and central role in child protection and supporting families. The third priority area is what we mentioned, and many of you mentioned, is of course prioritizing family-based alternative care for children without parental care by expanding foster care and kinship care options. Many countries, kinship care is really picking up because many children are not true orphans. They do have a living parent or extended family member that can take care of them, and all they need is support to be able to take care of that child, and then not remove that child from the environment in which they have grown up, which is their protective environment. Another area that we're working on is enhancing investments in strategies to address data gaps on children without parental care. And I think this call has shown all the wonderful work and evidence that has been generated from all the work. And as I said before, each year UNICEF measures the percentage of children in families-based care of the total number of children in all forms of formal alternative care, because we want to see who are the children who are in families-based care versus residential care, which is so much more harmful for children. And we collect this data. But there are still a lot of issues with data. It is not always easy to compare the data. There are different definitions, concepts, and principles would make it very challenging.
Thank you so much. I think we're needing to finish up and move towards Ellie, if that's okay.
Yes, thank you so much. Thank you.
Thank you so much, Kirsten. And as distinct, Kirsten was focusing on a lot about institutions or out of family care. Even children inside of family care have a lot of needs. Ellie, why don't you close us off with what the faith community can offer globally and domestically?
Yeah, if you guys are feeling like me right now, you're probably deeply burdened by the scope of this crisis, but my prayer is that we are also leaving here with a growing sense of excitement to be a part of the solution. What's clear is that this crisis is gonna require everyone. So we have to engage every corner of society, and faith leaders and faith communities are one of the most critical actors in responding to this crisis. They can be a part of preventing, preparing, and protecting children and families that have been impacted by caregiver loss. They're the first ones on the ground to respond when a family's in crisis. They can help a family in a medical crisis to prevent death. They can help make plans with families as they're realizing that loss is inevitable in their family. They can step in and support a family member who's maybe taking on care responsibilities and support them in doing that. Faith communities speak to a community's heart and to their motivations. So when stigma and discrimination are drivers in children living without family-based care, faith leaders can call that out. When culture says that a child who's lost a parent is cursed, faith leaders can call that out. And finally, faith communities can provide holistic support, not just responding to physical needs, which is important and vital, but those deeper emotional and spiritual needs that families have in the midst of crisis. I just want to share one quick story. One of Faith to Action's partners works with local churches in Southern Africa, and they told us this story. Pastor Ai, he runs a church in Zimbabwe, and he became aware of a specifically difficult situation with a teenage girl in town. Anashi is what they've called her. That's not her real name, but her father had passed away earlier and her mother had disappeared essentially, which was really crushing for Anashi. She was living with her aunt's family, but they were struggling to care for her because they were poor and they already had 4 children. And due to all of that stress, they were starting to mistreat her. She was really at risk of being sent away to live on her own on the streets. And that's when Pastor Ai reached out and he built a relationship. He started with the relationship with the family members. He talked to them about what's happening, the challenges they were facing. He talked about the importance of Anashi staying with them and the importance of family. And he offered help. He said his church community could help. So they ended up providing that family with some basic support for the basic needs that Anashi had. They also committed to providing monthly support for her school fees. And they, more importantly, started to build a relationship. They visited the community, church members visited the family regularly. They developed a relationship and ultimately kind of brought them into a community of support. Her aunt participated in trainings that the churches were hosting about supporting children's education. So ultimately that family was able to care for Anashi and care for her well and help her through the really emotional challenges that she was going through, having lost both of her parents. And I love this story because Anashi could have been a totally forgotten voice. She could have been on the streets in Zimbabwe, no one knowing her name, but I can tell her story today because the church stepped up in supporting her family. So this is just one example of how local faith communities can strengthen and support families to care for families in crisis and children who have experienced orphanhood. But it's not enough that faith communities just help. We all need to do our best for these children, and we need to help equip faith communities to respond in alignment with what we know is working for kids. So let me be clear, as it's been stated multiple times, orphanages and children's homes are not the answer. We have learned that lesson in our past. We know family is essential for healthy development for children. Therefore, we have to support faith communities to come around family-based solutions for children and families. So I just want to leave with encouraging you one last thing, Susan. Let's together engage, activate, and empower faith communities in this important work, because the reality is, I think you all know that it's going to take everyone's efforts, everyone's creativity, generosity, sacrifice, and dedication to be able to address this crisis. And if you'll allow me, I'd like to read a prayer that has encouraged me in this work, and I hope it will encourage you. We thank you, Heavenly Father, for your great and unending love for each and every child. For your perfect wisdom, you have created us for family, that every child may grow surrounded in love and with a sense of belonging. May your heart be our heart and your plan be our guide. For every child's heart, joy. For every child's soul, meaning. And for every child's body, protection. And for every child's mind, peace. For every child, a family. Thank you so much.
Thank you so much, Ellie. I'm going to ask you to stick that on a slide so we can send it to the end, because I think we were all so inspired by it. I can't thank you all enough. And if any of you are feeling a little bit overwhelmed about, oh, this is so big, where do I start? And I would just say, let's think about Ellie's story and start with the one child we know that a little bit of our help could go a long way. So thank you so much again. And we will get most of the slides to you. We may not be able to get all of them, but most of them we will be able to get to you. So thank you so much for participating today. We really appreciate each and every one of you. Have a great rest of your day. Bye.